Introducing Dr. June R. Ruiz, Programs and Advocacy Officer, Colorectal Cancer Screening Lead, Augusto P. Sarmiento Cancer Institute, and
Lang, a very good morning to everyone here at the Augusto Barcelon Auditorium and to those watching us virtually on Facebook Live. Welcome to OKS Kalang, a lung cancer forum on prevention and early detection. I am Dr. June Ruiz, the Programs and Advocacy Officer of the Augusto P. Sarmiento Cancer Institute and your moderator for the morning. Lung cancer is the leading cause of death globally, accounting for more than 2 million cases in the year 2020 and around 1.8 million deaths. Nakakapatay siya. The medical city, anchored on our principle of patient partnership, joins the world this Lung Cancer Awareness Month in raising critical awareness on lung cancer and turn the tide against the disease. I am delighted to see people here wearing their best denims. You might be wondering, why are we encouraging you to wear denim today? Is there any relevance to our event? Well, for context, the indigo that is used to dye denims is the same material that the surgeons in the past were using to localize small lung cancer for surgery. And also, the Philippine College of Chest Physicians started Denim Fridays this year, as denim stands for early detection. Since today is Friday, we wear denim. Now, to formally open our lay forum, the head of the section of pulmonary medicine, Dr. Esther Fredelin Tomas, will give us her opening remarks. Let's have her message.
Good morning, everyone, and thank you for joining us today either via Zoom or in the live audience. In behalf of the Augusto P. Sarmiento Cancer Institute and the Section of Pulmonary Medicine, it is my pleasure to welcome each and every one of you to this lay forum on lung cancer prevention and screening in celebration of Lung Cancer Awareness Month. It is known that lung cancer is a leading cause of morbidity and mortality worldwide. This is true even in the Philippines, where it is the second leading cause of cancer-related disability and deaths among Filipinos. Because of this, it is but timely for us all to be aware of what lung cancer is, its manifestations, and the risk factors that predispose us to its development. And in so doing, we can equip ourselves to be better prepared to deal with it. However, the ultimate goal is for us to be able to prevent it from developing through behavioral changes such as risk reduction in smoking cessation. And in the eventuality that lung cancer develops, the goal is to detect it early through adequate screening to significantly lessen its associated adverse health effects. Both of this will be discussed in depth by esteemed colleagues in pulmonary medicine during the duration of the event. And so, without further ado, we begin our forum. I hope that we all learn, appreciate, and proactively improve ourselves in order to be able to confidently say, OKS ka lang, OKS na OKS lang. Thank you and good morning, everyone.
Thank you so much, Dr. Tomas, for that very inspiring message. We are also fortunate to be joined by the Department of Health Officer in Charge, Dr. Maria Rosario Singh Vergere, and we have her recorded opening message. May we have her message?
To the Medical City President and Chief Executive Officer, Dr. Eugene Ramos, Chief Medical Officer, Dr. Ruben Casala, Consultant Director, Dr. Trixie Tiangco, and of course, to the head of the cancer program for the Medical City for Lungs, Dr. Josephine Ramos, at sa lahat ng kasama natin ngayong umagang ito, sa ngalan po ng kalusugan, isang maganda at malusog na araw sa inyong lahat. I am honored to once again join the Medical City's Augusto Sarmiento Cancer Institute in the celebration of the Lung Cancer Awareness Month. I would also like to express my gratitude and appreciation to the organizers in holding this important event. Platforms like these are crucial as they provide us with the opportunity to harmonize our work and galvanize the support of different stakeholders to improve the quality of lung cancer services in the Philippines. In the Philippines, cancer is the third leading cause of death, and every year, over 150,000 new cancer cases are diagnosed, and many of these patients do not receive proper treatment. Moreover, in 2020, lung cancer was among the most common types of cancer. In terms of incidence on both sexes and all ages, according to the WHO Global Cancer Observatory, alongside breast, colorectal, liver, and prostate cancers, and with such numbers, cancer remains one of the priority diseases of the department, and it is our priority to reduce the significant impact of cancer on our patients, their families, our communities, the healthcare system, and society at large. Through the enactment of the National Integrated Cancer Control Act, we were able to initiate the necessary groundwork to improve cancer service delivery in our country. For instance, we have implemented programs that increase access to cancer medicines and provide treatment support. But there is a need to emphasize that the cancer elimination and prevention is not just a matter of improving healthcare services. It requires coordinated, multi-sectoral participation. As such, we implemented a settings-based approach to ensure that the environments we live, we work, and we play are supportive of practicing healthy behaviors, reducing the risk of developing cancers. Moreover, we continue to reorient our services towards primary care and to more preventive and health-promotive measures so individuals remain healthy. Last year, we also launched the Cancer and Supportive Palliative Medicines Access Program, which is a mechanism in providing access to free medicines that are not yet covered by PhilHealth to minimize or eliminate out-of-pocket spending among our cancer patients. We also recently launched the Cancer Assistance Fund, which is a financial support mechanism in providing wider and convenient access to various interventions or services along the cancer care and control continuum. Through the implementation of the Cancer Assistance Fund, we were able to provide support for patients living with cancer and for cancer survivors. Outpatient and inpatient services are designed to complement existing financial support mechanisms in both the public and the private facilities. Lastly, for the intervention of increasing awareness for cancer, which is our objective for this morning's celebration, we have institutionalized the 7 Healthy Habits para sa Healthy Pilipinas, which will greatly contribute to the prevention of certain cancers associated with unhealthy lifestyle and vaccine-preventable diseases in our Health is Life campaign. We have Consult Tayo to help provide quality and affordable healthcare services through primary care. Friends, we know that cancer awareness will lead to action steps or efforts towards controlling cancer and ultimately reducing the incidence of and mortality from certain preventable and or treatable cancers such as cervical cancer, early stage of breast cancer, colorectal cancer, acute lymphocytic leukemia in children, and of course, lung cancer. This is why I am very glad to be part of this Lung Cancer Awareness Month with all of you, as it is a testament of your desire in taking bolder steps together toward a bigger and broader version of ending lung cancer in the country. We thank all community healthcare workers, public health physicians, general practitioners, surgical pathologists and radiologists, oncologists, nutrition medicine specialists, who work tirelessly to eliminate cancer in the country. The Department of Health is looking forward to expanding our work on cancer elimination strengthening healthcare system by setting up standards on cancer screening services, developing mechanisms to expand access through availability of outreach services, providing cost-effective modalities and technologies, among many others. We recognize and appreciate the passionate work and unwavering commitment that our partners in health had been tirelessly giving for the welfare of our Filipino people. With all of these initiatives, rest assured that the Department of Health remains steadfast in its commitment to implement the National Integrated Cancer Control Act to the letter and to its intent, notwithstanding the ongoing COVID-19 pandemic. That is why the big C, that is cancer, will always remain on our health agenda. Maraming salamat po, and let us all work together for a healthy Pilipinas.
To Dr. Vergeri for that very inspiring message. Truly, Dr. Vergeri is and was one of the hardest working doctors in the Philippines during our pandemic. For this morning, we are having a multidisciplinary lay forum that aims to cover every step of the individual's lung health journey with the help of our three speakers and panelists who will answer your questions during the Q&A session. Now, to introduce our first speaker, may I call on stage my co-host this morning, Dr. Loris Arayan. She's one of our medical oncology fellows.
Thank you, Dr. June.
Nice to have you here, Dr. Loris.
The pleasure is all mine, Dr. June. Good morning, everyone. It's such a nice sight to see all of you taking care of you and your family's lung health.
Dr. Loris, we assure our patients that after this event, they will be empowered with more knowledge on lung cancer and smoking cessation.
Because here at the Medical City, the Augusto P. Sarmiento Cancer Institute, we adopt a unique multidisciplinary team approach to cancer prevention, early detection, diagnosis, and management.
Dr. Loris, will you do the honors of introducing our first speaker?
It is indeed an honor to present to you our first speaker. She is the lead of the lung cancer screening program of the Augusto P. Sarmiento Cancer Institute and the program head of the Medical Cities TB Council. She is also a fellow of the following: the Philippine College of Physicians, the Philippine College of Chest Physicians, and the American College of Chest Physicians, and has published researches and studies focusing on pulmonary diseases. To share with us the updates on lung cancer statistics in the country and discuss the burden of disease, please welcome Dr. Josephine Blanco Ramos.
Good morning, everybody. I hope you are all well and okay today. This morning, we are going to have a lay forum on lung cancer with emphasis on preventing it and its early detection for cure. So this is a multidisciplinary lay forum for all of us to listen to, and hopefully the information we share here today you likewise share with your family, your loved ones, and your friends. So let me have my first slide, please. Okay, again, I am Dr. Josephine B. Blanco Ramos. I am the head of the lung cancer program of the APSI-TMC. Do you recognize any of these personalities? Two of them are movie actors. One is a movie director. One is an ex-senator. and one is a comedian. What do they have in common? These personalities suffered from lung cancer, and they all died from lung cancer. Lung cancer causes a great deal of distress, not only for the patient, but also for the family and caregivers. It is proven that it might not be because of the disease alone that causes the anxiety, the depression. That's why lung cancer is a burden. In Tagalog, pasanin. So it is important for us to know how to prevent lung cancer because the impact on the family and caregivers is such that tremendous effect. And it also has an effect on the financial status of the family. Okay, so what do we talk about today? We shall be sharing with you important facts on lung cancer that everyone should know and share with your loved ones and friends. What is lung cancer? What do we need to know about lung cancer? What can we do to prevent it? What can we do to detect it early? So our respiratory system starts with the nose, then down to the mouth, throat, voice box, windpipe, and lungs. The lungs are two sponge-like structures that are part of the respiratory tract that allows the exchange of clean oxygen that you inhale and dirty carbon dioxide that you exhale. Any condition that affects this exchange of gases may lead to respiratory conditions or respiratory diseases. So with this more detailed photo, we will see with each breath, air enters the lungs through the windpipe or trachea. The trachea branches into two bronchi, which are big tubes to the right and to the left. These bronchi are further subdivided into smaller air tubes called the bronchioles. And each bronchiole will lead to an air sac, or we call alveoli. It is in the alveoli that gas exchange happens. So oxygen from the lungs is absorbed by the blood into the bloodstream and distributed to the important parts of the body, and carbon dioxide from the blood is emitted into the lungs and which is exhaled into the atmosphere. If you imagine this type of cancer starts in very small structures of the lungs, it will take some time for the tumor to grow and cause symptoms. That is why we say lung cancer is detected late because the symptoms start late. And most of the time when symptoms start, patients or we try to dismiss these symptoms like it's an ordinary cough, it's an ordinary chest pain. So lung cancer is any cancer that starts in the lungs. Cancer usually starts in the cells lining the bronchi, smaller air tubes, and air sacs. Cells in the lungs begin to grow uncontrollably, in a disarray, and so this brings about the development of tumors or nodules. There are two main types of lung cancer. The first main type is what we call the non-small cell lung cancer. Majority of lung cancers belong to this group, about 80 to 85%. There are subtypes, we call them adenocarcinoma, squamous cell carcinoma, large cell carcinoma. The second group of lung cancer is the small cell carcinoma. Sometimes we call them oat cell carcinoma. The lung cancers in this group are usually less. About 10 to 15% of lung cancers belong to this group. But this is the group that tends to grow faster without symptoms and spreads faster. That is why 70% of patients are discovered during the later stages of their lung cancer, stage 3 or stage 4. And this is important for us to understand the two types of lung cancer because the approach of your physician will vary depending on the type of lung cancer that the patient has. So let's go to the stages of lung cancer. You know already that there are 4 stages of lung cancer. Let me describe to you the differences of each. Stage 1 is when the tumor is less than 3 centimeters. There are no spreads yet. Stage 2, however, the tumor size is bigger, more than 3 centimeters, but less than 6 centimeters, and has started to spread to a single point near the origin. On the other hand, stage 3, the tumor size is now more than 6 centimeters and has spread further to more structures such as the nearby lymph nodes. Stage 4, finally, the tumor has grown bigger and has spread to more distant structures such as the brain, the bones, liver, and even the adrenals, and even the other side of the lung. Why is it essential to know these stages of lung cancer? It is important for us to understand that if lung cancer is detected early, when it's in the early stage of stage 1 and stage 2, the doctors can offer cure through a surgical procedure. In contrast, when the cancer stage has reached the later or advanced stages of stage 3 and 4, surgical cure is no longer possible. And the prognosis prediction is poor even if the patient avails of the treatment with drugs and other agents. The prognosis is what the doctors use to project the life expectancy of the patient once they are diagnosed with cancer. So you usually hear, you have only 6 months more to live, you have only 1 more year to live. So the important facts on lung cancer, we will give you the correct information because there might be myths and some misinformation. This is the time for us to correct this. Lung cancer is still the leading cause of cancer death worldwide, meaning persons with lung cancer are more likely to die than those with other forms of cancer. An estimated 236,740 people will be diagnosed with lung cancer in 2022 in the US. 1 in 16 persons will be diagnosed with lung cancer in their lifetime. Or 1 in 15 million and 1 in 15 will have lung cancer among men, and 1 in 17 women will develop lung cancer. So it's very, very common. Lung cancer kills almost 3 times as many men with prostate cancer, and it kills almost 3 times as many women with breast cancer. So it's really very deadly. Approximately 130,180 American lives are lost annually because of lung cancer. So according to the Globocan report, in 2020, the cancer statistics show that lung cancer is the 2nd most common cancer worldwide and the leading cause of cancer deaths in both sexes. The most significant risk factor of lung cancer is still smoking. And now we are realizing that increasing age is becoming to be an important risk factor as well. Lung cancer has a very poor prognosis with an overall survival of only 20.5%. So a quarter of patients with lung cancer will really live longer, but 75% of them are bound to die sooner. However, if lung cancer is detected early, the prognosis gets better since it is more amenable to treatment and even cure if surgically removed. So lung cancer really kills. If you combine the deaths from prostate cancer, breast cancer, pancreatic cancer, the total or sum of these 3 deaths from cancers is still over exceeded by the lung cancer death statistics. The estimated cost of lung cancer treatment in the United States is said to be about minimum of $3,580 US, which is equivalent to about 207,000 pesos in the Philippines. So for the past years, the medical community has been campaigning since 2014 for the prevention and early detection of lung cancer to improve our statistics. These efforts were made more people aware of what needs to be done to defeat lung cancer. With a heightened awareness, much has been written in our daily newspapers on lung cancer, at least every November when it's lung cancer awareness month. We have articles since 2014, Understanding Lung Cancer. I have Stage 4 Lung Cancer, which is an article on Miriam Santiago in the Field Star in 2014. And an article continued to go out. Hope for Lung Cancer Program. Lung cancer is still the deadliest type of cancer in the Philippines. Anyone can get lung cancer. Detecting it early is crucial, according to the Inquirer in November 2022. So lung cancer in the Philippines, our data is not different from those data that we see abroad. 19,180 new lung cancer cases were recorded in 2020. That is 12% of the total cancer cases. Most of the patients are male. These numbers put lung cancer in the second place, next to breast cancer only, among the new causes of cancer. The total cancer deaths was 92,606 in the Philippines, with lung cancer contributing the most deaths at 17,063 or 18.4%. These numbers really show that lung cancer in the Philippines follow the global trends. But look at this. The prognosis really, or tinatayang kalabasan or prediction with regards to lung cancer is really very, very low. Prostate cancer has a prognosis of 99%. That's very good. Breast cancer also very responsive to treatment at 89%. Colorectal is not far behind. It's on the third. However, for lung cancer stages 1 and 2, the prognosis is better at 53%, but becomes lower at stage 4 at 4%, for a total of prognosis of 18%, which is rather low. So, if we don't prevent lung cancer, and unfortunately the individual develops lung cancer, here are the possible expenses that that individual will have to look at. Screening for lung cancer through the low-dose CT scan will cost them a lot, thousands of pesos. If you want the real values, I can give you, but I don't want to scare anybody. But if we need to scare everyone, that the expenses is tremendous and it's not a joke, then maybe our purpose for this forum, that it is indeed a deadly and expensive condition, probably our purpose has been done. Histochemical and immunochemical stains are very expensive. Those are stains that they use when they biopsy. Surgical treatment is expensive. Just to give you a ballpark figure, they spend about 400,000 to 900,000 if the surgical procedure is for treatment already. Then they have to consider about chemotherapy, radiotherapy expenses, palliative care expenses for those who choose not to be operated on, or those who choose not to have any more chemotherapy treatment. We have some good news though. Globally, they have been observing this data The number of new lung cancer diagnoses are declining steadily from 2009 to 2018, probably because of campaigns and advocacies like this. Another observation is lung cancer deaths have been cut in more than half in men and has been cut by a third in women. There is some progress also in early detection of lung cancer. The rate of localized or early stage diagnosis is now increased by 4.5% yearly from 2014 to 2018. If they are detected early, we said the overall increase in the 3 years survival rates will improve, the prognosis will improve. In the Philippines, like what you heard Dr. Rosette Vergere mention, the DOH started to implement the Cancer Assistance Fund, which provides support for those battling cancer and patient survivors. We were told that this will start in 2023 because the budget is still being determined. Okay. Having mentioned all that, what then can we do to prevent this dreaded condition? Let us show first the factors that put a patient at risk, peligro, for lung cancer, and these are cigarette smoking. It is still the most significant risk factor for lung cancer, and yet it is very preventable, right? So people who do not smoke can still have the risk for lung cancer by secondhand smoking. This is inhaling the smoke of a smoker's exhaled smoke. And third-hand smoking, which is smoke left behind in the clothes of a smoker, on the furniture, carpets of where the smoker went, can also be a risk factor for non-smoking people. Radon exposure is another risk factor, especially for in homes where there are basements. Aging, we mentioned that just getting old will already put anyone at risk for lung cancer. Family history is an important risk factor, especially if one of the parents has lung cancer. Pollution really puts a person at peligro. This includes indoor and outdoor pollution. Occupational exposure of our Filipinos who work in mining companies and heavy metal exposure can really put them at risk also for lung cancer. So it's important for us to be aware and probably observe our families and friends of these common signs and symptoms of early lung cancer, and you will know what to do. So very common of which is enduring cough. If the cough lasts more than a month, going on the second month, maybe that patient should already have a talk with a physician. Recurring lung infections. For those who have been having pneumonias on and off, probably they have to be taken a look at a deeper level and find out if there are hidden tumors there that explains this recurrent infection. Any blood in the sputum, aches in some parts of the body, especially on the chest part, front or back, trouble with breathing, hoarseness of voice, wheezing sound when a patient inhales, any body weakness, loss of appetite, when the patient easily tires, or when there is weight loss. These are early signs of probable early signs of any lung condition, so it's important for us to consult the physician. So, talk to a doctor. If you notice that these are happening to your family members and friends, make sure that they see a doctor as soon as possible. Advise them to make a list of the symptoms that they feel, especially those that bother them at day or at night. Record when they all started and the things that the patient needs to do to make the symptoms go away. Advise them to bring a list of the medicines, their doctors, the tests that they have been done on them, and the results that they may have had. And they should know the family history. what the parents have, so they will know what they might get as they get older. Ask them to prepare a list of all their questions to ask the physician so they will not forget anything. Encourage them to talk to the doctor timely, which means promptly. Do not delay. And expect timeliness from the physician. Remember that the doctor will not know right away what is wrong with you because they need time to study your case and to run some tests and study the results. And the patient should be ready to listen to whatever the doctor would advise. Trust the doctor that the doctor's advice will always be for the best interest of the patient. Be ready to share the necessary information to your physician. Be prepared to undergo some tests, usually initially a chest x-ray and some chest scans, and always be prepared to follow up with your doctor. So at Medical City, this is what we always say, we can always do something for lung cancer. Lung cancer can be prevented. Lung cancer can be cured if detected in its early stage. So for the Medical City APSI, these are our advocacies. Let's prevent lung cancer through the smoking cessation program that we have here. Detect early lung cancer through screening that we also have here. We encourage a very strong physician-patient partnership during the journey in lung cancer management. So the patient will be allayed of all the anxieties and fears because the doctors will be effective partners in their treatment. At the Medical City, these are our advocates. So it's important for our patients to have open communication with your physicians so we will understand each other better. So similar to the usual saying, prevention is the best cure, this is a quote which I would like to share with you. The greatest medicine of all is to teach people how not to need medicine or how not to get the disease. We are now emphasizing how not to get lung cancer. So for the helpful tips that we have for each and every one of you to avoid or prevent lung cancer, quit smoking. Tell them to quit smoking or encourage our young ones not even to start smoking. And then what you can do is avoid secondhand smoke, avoid third-hand smoke. Always aim for a healthy weight. Be physically active, which means we are encouraging you and other patients to exercise regularly. Let us limit our indoor exposure and outdoor exposure to pollution, especially heavy traffic. Get flu and pneumonia vaccinations regularly. It helps that you get your checkups with your physicians and you get your vaccines. The doctors can follow you up and prevent other conditions, particularly infections. For those who work in factories, they need to wear their protective gears when they are exposed to such like dust, silica, chemical fumes, etc. So DOH campaign is Hope from Within. Let's talk, let's test, talk, and take action. At the APSI of the Medical City, we offer the same. Hope springs here. So I think that's the end of my slides. Thank you very much for listening.
Thank you, Dr. Jopay Ramos, for that very insightful presentation. Lung cancer is indeed a burden to the individual's health and quality of life. Napakasakit ho at napakamahal magka-lung cancer. Dr. Loris?
That is why it is vital that we control what we can control. Get to know how you can detect lung cancer early with our second speaker. She is a pulmonologist and a lung specialist here at the Medical City, who specially trained at the National Cancer Center in Japan. She is also a board regent at the World Association for Bronchology and Interventional Pulmonology. Please welcome Dr. Christine Chavez.
Thank you, Dr. June and Dr. Luis. Welcome to our audience here at Barcelona and in Facebook virtually. Allow me to find my slides. Okay. So today, Dr. Ramos has already extensively discussed the risk factors, the symptoms, how lung cancer begins. I will be repeating some of those, but only for a brief moment. So, as emphasized a while ago, early detection of lung cancer through screening offers the best chance of cure. So these images represent an individual's lungs. So normally, our lungs were designed by our Creator to breathe in oxygen and breathe out carbon dioxide. Anything that is inhaled that is not supposed to be inhaled can cause the cells in our lungs to grow abnormally and cause lung diseases. And one of these lung diseases is lung cancer. So when there is a constant insult to the lung cells of the body, an individual who is genetically predisposed can have mutations in the cells of the lungs, and which can lead to lung cancer. Now, depending on the growth, if for example this mass in the lungs grows or spreads to the other parts of the body, it can manifest symptoms. So what are these symptoms? It can manifest symptoms such as cough that does not go away if the cough has been there for more than 2 months or 3 months. If there are recurring lung infections such as pneumonia or bronchitis, if there is hoarseness of voice, coughing out of blood or chest pain, or if the tumor has already spread to the other organs of the body, manifestations of those abnormalities in the other organs can be felt. However, these symptoms that we mentioned are usually late manifestations of the disease of lung cancer. In the early stage of lung cancer, there are usually no symptoms. So paano na yun? It's the leading killer, di ba, among all cancers. But then, wala siyang symptoms in the early stage. That's why we look at our risk factors. So what are the risk factors for lung cancer? Dr. Ramos has elaborated on it a while ago. The most common is smoking, occupational and environmental exposures, genetic predisposition if you have a family member who has cancer, and outdoor and indoor air pollution. If you are exposed to secondhand smoke, you're as good as a smoker. So these are the risk factors for lung cancer. May I ask the audience, I understand some of our audience are doctors. What is the screening tool for breast? Breast cancer is the most common cancer, right? So what is the screening tool for breast cancer? Mammogram, right? Okay, for colon cancer. Colonoscopy, sabi ng gastroenterologist. Thank you. These are common already. These screening tests have already been established for many years. For lung cancer, for many years until 10 years ago lang, that was the time that experts were able to find a tool that, because for a screening tool to be effective, it has to decrease the number of people who die from the disease. So 10 years ago, finally, the experts found that low-dose chest CT scan screening is the tool that we can do to individuals who do not have symptoms but have risk factors for lung cancer. It was proven that using low-dose chest CT scan can decrease the number of people who die from lung cancer. So among the risk factors that we mentioned a while ago, what were the risk factors that were proven to be the criteria for undergoing a low-dose chest CT scan? So a healthy individual aged 50 to 75 years, heavy smoker, which is defined as smoking more than 15 cigarettes a day for more than 25 years, or more than 10 cigarettes a day for more than 30 years. It's good if an individual has quit, but if the quit time is less than 10 years, the risk is still there. But the good thing is, smoking is a modifiable risk factor. So you can always decrease your risk. So later on, hopefully, with the results of the ongoing studies now, we will be able to add some risk factors. Kasi we don't want naman to screen everyone by low-dose chest CT scan. That will lead to unnecessary tests, diba? So, pinag-aaralan pa yon. What are the other risk factors, especially among Asian women, that can that fit into the eligibility for low-dose chest CT scan screening? So as I mentioned, lung cancer screening can be the key to survival. So for the breast, mammogram; for colon cancer, colonoscopy; for lung cancer, low-dose chest CT scan. So the low-dose chest CT scan can be done simply. There is no need for fasting. There is no need for blood tests to be done before the procedure because there is no dye. There is no need to place a dye during the screening. So you just go there for your appointment. You will be asked to lay down on the gantry, and it will take less than 30 minutes to finish the test. This photo on the left, on your left side, is a representative image of one of our patients where I trained to have early lung cancer. Do you see the small white area? So that was beginning lung cancer. It is our vision that eventually we will be able to detect more of these than the one on the right side. Because the one on the right side, you see the white solid density on the right side of the chest. So that is when the early stage lung cancer evolves, it can evolve into that. So the earlier stage that we catch the cancer, the better and more options that we can offer the patient. So this is the value of screening. Usually, if cancer is in this stage, there are no symptoms yet. The symptoms start when it's that big or it even grows larger and affects the other parts of the body. Now, of course, what we want to see is if an individual is at risk, we want to see if there is any abnormality. If there are no abnormalities, then good. Let's continue decreasing our modifiable risk factors. But if there are abnormalities, your multidisciplinary team of doctors will talk to you if you need a biopsy. A biopsy means taking a sample from that area of the lungs which is abnormal. The biopsy can be done through the airway, through the mouth, or through the skin, both of which it can be can be done minimally invasively or through a more invasive approach, depending on what you need. So the purpose of doing this is to get a sample of tissue which we will look at in the microscope to see if there are any cancer cells. If there are no cancer cells, if there are cancer cells, we screen the other parts of the body, the status of the tumor. If the tumor is localized to one part only, then we can remove it surgically. But if it has spread to other organs, there are also other treatment options such as chemotherapy, radiotherapy. Oh, we can also remove locally located tumors by radiotherapy if the patient cannot undergo surgery. But if it has spread, we can offer chemotherapy or oral targeted therapy. So those are my takeoff points. Usually, lung cancer in its early stage does not have symptoms. So it would be good for us to know our risk factors. And if you or any of your family members fit into the eligibility criteria for screening, then let's have ourselves screened and lower our risk factors. Thank you.
Thank you, Dr. Christine Chavez, for that very enlightening talk on lung cancer screening, especially to those with risk factors. So if you or your loved ones are at risk for lung cancer, we want you to consult at our APSI Center, and the number is 898-1000, 898-7000, extension 6214. Nagpa-plugging lang ho kami. Dr. Luis.
Now we're down to our last speaker, and he's definitely not the least. I'm pretty sure maraming makaka-relate sa kanyang presentation. He is a trained fellow of pulmonary medicine at the Lung Center of the Philippines. He is also a fellow of the Philippine College of Physicians and Philippine College of Chest Physicians, a lecturer at the Ateneo School of Medicine and Public Health, and the program coordinator of the Smoking and Tobacco Addiction and Relapse Therapy, a nicotine-free way of life, or also called Start Anew, the smoking cessation program of the Medical City. To discuss with us the hazards of smoking and the health benefits of quitting, let us all welcome Dr. Alan Bacayana.
Good morning. Smoking is the major risk factor in developing lung cancer. Today, I'm going to talk on the smoking hazards and the health benefits of quitting. In the next 15 minutes, it is imperative to know why smoking is harmful to the body. Contents of cigarette and vape that makes it dangerous, why it is difficult to stop smoking, its hazards of smoking, and the benefits of quitting. Smoking is one of the biggest causes of death illness. It is responsible for close to 90% of lung cancer cases. Smoking one cigarette can take 11 minutes of your life. Smoking kills and causes serious illnesses. For us to understand better why smoking is dangerous, it is very important to know the different components of a tobacco cigarette. Shown here are some of the chemicals and ingredients present in a single cigarette. There are approximately 600 ingredients in cigarettes. When burned, cigarette smoke produces more than 7,000 chemicals, and at least 69 of these substances are known to cause cancers. Listed here importantly are nicotine, which causes smoking addiction, and acetaldehyde, which is cancer-producing. E-cigarettes or vape is a device that utilizes a battery to heat up a special liquid contained in a cartridge to produce an aerosol that users inhale. The electronic juice that fills the cartridges usually contains nicotine, flavorings, and other chemicals like tetrahydrocannabinol. When the electronic liquid heats up, more toxic chemicals are formed, which is a harmful water vapor. Researchers have found out the following are the toxic chemicals and metals present in electronic cigarette. It contains nicotine, a highly addictive substance that negatively affects adolescent brain development. Carcinogens. These are chemicals known to cause cancer, including acetaldehyde and formaldehyde. Other important chemicals include propylene glycol, acrolein, heavy metals as nickel, tin and lead, cadmium, benzene, ultrafine particles that can be inhaled deep into the lungs. People should realize that inhaling these substances could cause serious diseases. Then why is it difficult to stop smoking? It's because of the nicotine that is present both in a tobacco and electronic cigarette. Most people smoke primarily because they are addicted to nicotine. How does this happen? Once you inhale the cigarette, nicotine reaches the brain in 10 to 19 seconds. When a person smokes, nicotine reaches the brain easily and stimulates the brain receptor, causing the release of this pleasure-inducing chemical, which is the neurotransmitter dopamine. Initially, the smoker feels pleasure and calmness, reduced tension, appetite suppression, and enhanced performance. Once you stop smoking temporarily, the nicotine level decreases. Then you develop withdrawal symptoms. So smokers tend to crave another cigarette until you reinforce the habit. You smoke more and more until your body finds the level that keeps it satisfied. At that point, you're addicted, and once addicted, it's difficult to quit. This is the power of nicotine addiction. What are the hazards of smoking, and how harmful can smoking be? Smoking cigarettes can have many harmful effects on the body. Smoking for a long time affects the whole body and all the major organs. Young or old, some of these effects can lead to life-threatening complications. I will just run through all these health hazards of smoking. Shown here is a smoker's body, reflecting how dangerous chronic smoking can be to our health. According to WHO, every 10 seconds, someone dies from tobacco smoke. 90% of smokers started smoking early in their teens, and other studies have shown that those who started early and continue to smoke for 2 decades or more will die 20 to 5 years earlier than those who never smoked. In addition to the well-documented link with lung cancer, smoking cigarettes can also cause other forms of cancer. The American Cancer Society report that smoking cigarette causes 20 to 30% of pancreatic cancers. As I mentioned earlier, tobacco and electronic cigarette contains cancer-causing chemicals that are dangerous to our health, and this gives rise to lung cancer in the long run and many other cancers of the body. Smoking cigarettes also presents a greater risk of developing tuberculosis and dying from chronic obstructive pulmonary disease. It can also trigger or exacerbate asthma attack and other respiratory symptoms. Smoking cigarettes can damage the heart, the blood vessels, and the blood cells. The chemicals and tar in cigarettes can increase a person's risk of atherosclerosis. Smoking also increases the risk of stroke, heart attack, peripheral artery disease, and Buerger's disease. Even people who smoke fewer than 5 cigarettes a day can have early signs of cardiovascular disease. The CDC report that those people who smoke regularly have 30 to 40% risk of developing type 2 diabetes than those who do not. Smoking can also make it more difficult for people with diabetes to manage their condition, including sugar control. The American Lung Association lists a few common health side effects of smoking that you might not be aware of. The chemicals in tobacco smoke enter the bloodstream and eventually reach the eye. Tar is deposited and eventually leads to age-related macular degeneration and sight loss. The chemicals from smoking cigarettes can damage both the male and the female reproductive system. In females, it can affect the hormone levels and make pregnancy difficult. In males, the risk of erectile dysfunction and infertility increases the more cigarettes are used and the longer a person smokes. According to CDC, smoking can affect pregnancy by damaging the fetus body development, increasing the risk of sudden infant death syndrome, increasing the risk of ectopic pregnancy and preterm delivery, and causing congenital anomalies like the cleft lip or cleft palate. People who smoke have double the risk of gum disease. Smoking tobacco can limit a person's ability to taste and smell things properly. It can also stain the teeth yellow or brown. Smokers lose bone density at a faster rate than non-smokers, which put you at risk of hip fractures, osteoporosis, and rheumatoid arthritis. Due to the physical cell damage and hormonal imbalance that the toxins from smoking bring to the body, the risk of bone injury increases. Chronic smoking suppresses the immune system and damages the lung tissue, making it more difficult for the body to fight off respiratory infections. Smoking faces a 50% higher risk of developing severe disease and death from COVID-19 virus. What are the advantages of quitting tobacco? Quitting smoking can be challenging. It improves the health status and enhances quality of life. It reduces the risk of premature death and can add as much as 10 years of life expectancy. It reduces the risk of many adverse health effects, including poor reproductive health outcomes, cardiovascular diseases, COPD, and cancer. It reduces financial burden. Quitting smoking saves money. How? If you smoke the average of 15 sticks a day, compute it monthly and annually, you'll definitely set aside 43,200 pesos per year, which is a huge amount of money. Pero kung smoker ka, pera mo naging abo pa. So smoking studies have shown that after you smoke your last cigarette, you already observe a positive changes in your body that tend to continue for years. After 20 years of quitting, heart rate and carbon monoxide level in the blood drop to normal levels. Blood pressure decreases while the temperature on both hands and feet normalizes. 8 hours after quitting, your oxygen and carbon monoxide level in the blood drops to a comparable level of someone who never smoked. 24 hours without cigarettes
the nicotine level in the blood drops to zero. The chance of developing heart attack decreases. In just 2 days, your sense of smell and taste get better. Several weeks after quitting, your blood circulation as well as the function of your lungs remarkably improves. Several months after quitting, you'll notice this appearance of coughing, nasal congestion, fatigue, and general improvement in breathing and vitality. After a year, the risk of heart attack is as much lower and the blood pressure level normalizes. Coughing and upper respiratory problems begin to improve. After 2 to 5 years, the risk of stroke drops to that of someone who does not smoke. After 10 years, the risk of lung cancer, gastrointestinal as well as kidney and bladder cancer is half of that someone who currently smokes. After 15 years, the risk of heart disease is similar to that of someone who never smoked, and the risk of death to almost that of never smoker. And after 2 decades of quitting, the risk of pancreatic, mouth and throat cancers drop close to that of someone who does not smoke, while cervical cancer cut to half. You see the overall benefits of quitting smoking. Quitting smoking lowers your risk for age-related diseases and can add years to your life. So if you need help to kick the habit of smoking, enroll yourself to our TMC Start Anew Smoking Cessation Program. It's never too late to give up smoking. Quit for life. Thank you so much for listening, and have a pleasant morning, everyone.
Thank you, Dr. Alan, for that very informative lecture on the dangers of smoking. So sa mga smokers natin dyan, ihinto na natin, Dr. Luis, di ba?
I definitely agree with Dr. Alan. Dahil lang Yossi, kadiri. We have come to the second part of our lay forum, the question and answer portion. As promised, this lay forum will have a multidisciplinary team approach to the management of lung cancer.
At this time, we call back on stage our 3 speakers, Dr. Jopay Ramos, Dr. Tin Chavez, and Dr. Alan Bacayana. Also, we will be asking our panelists to join on stage. We have Dr. Francis Millar from Thoracic Surgery Section, Dr. CJ Villafuerte from Radiation Oncology Department, Dr. Joyce Maglake from Psychiatry, Mr. Michael Yanga from Employee Health and Wellness Clinic, Mr. Robbie Posadas, our business manager at APSI, and my co-host, Dr. Luis, will be our resource person on medical treatment for lung cancer. So while waiting for our panelists and speakers, for those in the audience, if you have a question, please approach one of our microphone stands to ask your question. And for those online, you could send your questions via the comments, and we will try to answer some of them in a limited time. Okay, so I think we have everyone here. Welcome to our Q&A session. So we will be asking questions to our speakers, and we will do like a first round of questions. And I will start with, for Dr. Jopay Ramos. The first question is, we know that lung cancer is the country's biggest cancer killer. What is it about this cancer compared to other cancers that it makes it very deadly? Nakakapatay talaga siya. What do you think, Dr. Jopay?
The basic reason for that, I guess, Dr. June, is that Lung cancer is usually discovered late, usually at stages 3 and 4, where the prognosis or the prediction for them to live a longer life and respond well to treatment is very, very low or very, very poor. That's why our advocacy is really sana makita ang mga lung cancer ng maaga. Stage 1 or stage 2, where surgical treatment really can offer cure. We mentioned a while ago, especially by Dr. Tin Chavez, it's really difficult to screen for lung cancer. Sa lahat ng mga cancer, yung screening procedure ng lung cancer ang pinakamahal, di ba? So, mura lang siguro yung sa colorectal CA screening, yung mammogram, not as expensive. Pero ang screening para sa lung cancer ay medyo mahal. Kaya ang mas maganda pa talagang gawin ay alagaan ang baga na maging malusog, iwasan ang magkasakit sa baga, at yan malalaman natin if you know yourself. So you know if you are at risk for lung cancer or any disease. If you are at risk for lung cancer, magpatingin na sa doktor, magpartner na sa doktor. Doc, tignan mo ko every year or as often as you need para maagapan natin, maiwasan natin na ako ay magkakasakit. And so the doctor becomes a partner in your goal to prevent these deadly diseases. So I guess discovering lung cancer at the later stages is one of the reasons why a lot of them really die from it.
Thank you very much, Dr. Jopat, for pointing that out. So that really means na kailangan talaga ma-discover at the early stage or even prevent lung cancer. I think we have a question. Dr. Laris, you have a question for our next speaker?
This question is for Dr. Tin. So, napakahirap talagang i-convince ng mga patients na magpa-screen, especially dahil late yung mga symptoms. So, what is the best way to convince patients for lung cancer screening?
Thank you for that question. Actually, karamihan naman ng mga pasyente natin, adults na, di ba? So, different individuals have different perceptions of the illness. They have different stories that they have gone through their lives. So, it will be difficult to come across as someone who is imposing. So, it is important when I talk to patients and dun din sa mga nakikinig sa atin ngayon online, na we are not selling anything. It's important na kaya kami merong ganitong lay forum. We want you to understand bakit importante yung lung cancer screening, ano yung mga risk factors. Kasi if an individual understands kung ano yung risks and benefits at saka kung ano yung pwedeng mangyari kapag na-diagnose siya ng maaga or pag hindi siya na-diagnose ng maaga, then he or she will be able to decide for himself or herself kung ano yung gusto niya. I think it is our job as doctors to make sure na naiintindihan ng patient. But the decision has to come from the patient.
It is really important to involve our patients in the decision with regards to their bodies. So, another question for our panelists?
This is for Dr. Alan. Okay, so given all the bad effects of smoking and nicotine addiction, so what is the best strategy to ask our smokers to quit smoking? Anong best way talaga para makumbinsi natin siya? Dr. Alan?
Thank you, Doc June. Marami po pa talagang paraan ng paninigarilyo, no? Una, merong tinatawag na cold turkey stopping. Ibig sabihin nun, biglang paghinto ng paninigarilyo. But because nicotine is present in a cigarette, di ba? So, because of nicotine addiction, kadalasan po, after several weeks or months or even after a year, babalik at babalik din sa paninigarilyo. So, nagkakaroon ng relapse. So according to study, the best strategy to quit smoking is really the smoking cessation program, which we have here in Medical City. We have the Start a New Smoking Cessation Program. Ito ay isang programa upang matulungan ang isang smoker to stop smoking completely and prevent relapse. So it's a team effort, no? Meron pong pulmonologist, nurse coordinator, and psychiatrist. Tulong-tulong po yan para hindi na mag-relapse or mag-prevent na talaga or totally mag-quit na ng panigarilyo. So in Medical City Hub Start Anew, ito po ay pwedeng online or face-to-face, no? So merong 5 sessions ito. Una po ay ang pagkakaroon ng personal assessment by our pulmonologist or individualized assessment by our pulmonologist. And then the nurse coordinator will have a lecture on the ill effects of smoking and motivate the patient to quit. And then ina-assess po yung smoker kung nicotine dependent siya o hindi. Then we will advise for treatment like nicotine replacement therapy. And after that, ginagay din po at yung isang smoker para maiwasan magkaroon ng withdrawal symptoms, how to cope with the withdrawal symptoms and other side effects of the treatment. And very importantly is how to prevent relapse. So, para hindi na tuluyang bumalik sa panigarilyo, meron tayong psychiatrist, no, who will give psychotherapy to the smoker. Okay? So, after that, mayroong quarterly advice or quarterly call from our nurse coordinator para tuluyan na talagang mahinto yung panigarilyo at hindi magkaroon ng relapse. Okay? So if you want to start a new life, no, without nicotine, enroll yourself to start a new smoking cessation program. Thank you.
Thank you, Dr. Alan. Apparently, we do have a question from our Facebook Live. Isingit muna natin to. And I think si Dr. Alan would probably be the best person to answer this. Let me just read it for everyone. A chronic smoker suddenly stops smoking after more than 20 years of smoking, more than a pack daily. So that's very good, diba? Nag-stop na siya. But then he later experienced air hunger thereafter. What should he do? Dr. Alan?
That's a very good question. No? So 20 pack years smoking history, more than 20 years na siya nag-stop ng panigarilyo. No? So kailangan minomonitor. So dito na po nakikita yung early detection ng mga lung diseases. So dito na po importante yung magpa-screening. No? Magpa-screening, yung sinasabi ni Dr. Tin kanina, paano magpa-screen. Kasi dito po kailangan na pong marami na pong mga diseases na mangyayari na after 20 years of quitting, no? Especially pag more than 20 pack years ka ng panigarilyo. So, dito po, kailangan mo na pong ayusin sarili mo, magpakonsulta ka ng doktor, magpa-screen for lung cancer, if you have COPD, ganon. Kaya, nagkakaroon ka ng air hunger or breathlessness. So, kailangan mo na magpa-screen, you consult a doctor talaga. Okay?
Thank you, Dr. Alan. Dr. Larice, I think may question then. After this, we will go, I think we'll do one question lang yata from Facebook Live and then we'll ask the panelists. Okay,
So
Dr.
it's really
Larice?
important, no, to encourage patients to stop and not judge them. In fact, we should encourage them to stop. So this is a question from Facebook Live, a question for Dr. Jopay. So, hi, Dr. Ramos. How about vapes? Do they contribute to lung cancer? And what is the second and third hand smoking?
I will answer for that. No? Okay. What about vaping? Vaping is parang e-cigarettes din siya, no? Ang vaping po or e-cigarette, it is a device, no, that utilizes a heat to produce an aerosol, no, that the users inhale. Okay? Makikita po natin na ang vape po is not safe. No? It's not safe. It still contains nicotine and carcinogens. No? So in the long run, marami pong sakit na dudulot nito. No? So it's not safe. It contains carcinogens, so in the long run, you may also develop lung cancer. Ano pa ibang question? Second-hand. Okay. What is second-hand smoking? Yung second-hand smoking po ay nalalanghap mo directly ang ang smoke, no? Ang cigarette smoke from somebody who smoked. Yun yung second-hand smoke, no? And then, may hazards din siya. It's the same as first-hand smoke. It contains, yung nalanghap mo, you should realize that you are inhaling 7,000 chemicals. And of these, 60 of these chemicals could cause are carcinogen. So in the long run, you may also develop lung cancer. Okay? The third-hand smoke, ito po yung smoke residue, no? Smoke residue, remember yung smoke kasi naglilingers in the air for 30 to 45 minutes, no? So, magkikling siya to the clothing, sa smoker's hair, surfaces, even the couch and even the floors and wall, no? And dito po ay very important din sa mga bata kasi ang bata sila yung nagko-crawl. So, kasi ang third-hand smoke pwedeng mag-clear sa mga toys. So, sila yung usually na-hazard. Makalaking hazard sa mga bata. But, how to quantify this, yung hazards ng third-hand smoke, ay hindi pa napag-aralan talaga yung third-hand smoke. But still dangerous.
Thank you, Dr. Alan, for that comprehensive answer. Now we move on to our panelists. The first question is for Dr. Francis Miliar. So, Dr. Francis, what is the role of surgery in the treatment of patients confirmed to have lung cancer?
Okay, first of all, thank you, Dr. Doris, for that question. And then number two, good morning to everyone who's listening right now. Incidentally, I just finished surgery, lung cancer surgery, kaninang madaling araw, 1 o'clock in the morning na kami nakatapos. So timing itong lay forum na ito. To answer the question, as a thoracic surgeon, okay, very important before I touch the patient, kailangan munang i-stage siya properly. Kasi yung stage ng lung cancer na mentioned earlier, stages 1 to 4, meron dong advanced cancer, stage ng lung cancer, stage 3B to stage 4, na hindi na magbe-benefit ang surgery with curative intent. Merong role ang thoracic surgeon in addressing like fluid in stage 4 lung cancers for palliative treatment, but it's not curative. Unlike yung stages 1 to 3A, the role of the surgeon there is to remove the entire tumor, the gross tumor. So may curative intention, but of course before we do that, kailangan merong risk assessment ng cardiologist, ng pulmonologist. So hindi basta-basta inooperahan. So we make sure that the patient is optimized to undergo the surgery, no? And of course, we should know the stage kasi gaya ng nabanggit ko, yung advanced cancer stage ng lung cancer cannot be operated already, no? Yung benefit is no longer there. So iba ng modality ang gagamitin doon. So after staging, anong klaseng surgery bang ginagawa? Basically, it's what we call lobectomy. So tinatanggal yung lobe o part ng lung kung nasan yung tumor, yung nodule. And so basically ganun, ang malaking question lang dito is, how do you effect that lung resection? We do it minimally invasive, o kung na-encounter nyo, nababasa nyo na video-assisted thoracoscopic surgery wherein the incision or the access to the chest cavity is quite small, around 4 centimeters, 4 to 6 centimeters yung hiwa. In comparison, doon sa ginagawa pa rin naman ngayon, pero is no longer the standard, yung tinatawag na open thoracotomy wherein the incision is quite long. No? Ngayon, medyo high-tech because we make use of that. So, small incisions lang. But of course, in terms of, you might be curious about the pricing, of course, the minimally invasive approach is, yeah, it's expensive. No? Pero in terms of recovery, mas maganda for the patient. Okay? So, yeah.
Thank you, Dr. Francis, for explaining when is surgery needed, and what are the different types of surgery that can be done on patients who will benefit from surgery. So moving on, yung next question natin is for my co-host, si Dr. Luis. She's a medical oncologist, so she can answer the next question. So we've talked about the indications for surgery, di ba? So ang question naman is, when is medical therapy, when does the medical oncologist comes in, ano yung indications for the medicines we call chemo, and what are the side effects of chemo? Dr. Luis?
Okay, so that is actually a very difficult question to answer because lung cancer is quite complex. So again, yung mga pasyente hindi dekahon. So each patient will have their own comorbidities, financial aspect, how they perceive their disease. That's why it's very important, again, to emphasize multidisciplinary discussion between doctors and most importantly, involving the patients in their choice of treatment. So from a medical oncologist perspective, usually we give chemotherapy as a form of adjuvant, pag sinabing adjuvant, right after surgery, or pwedeng kasabayan siya ng radiation therapy. But we just want to emphasize now, with the development of molecular testing, we now have new medications in the form of targeted therapy and immunotherapy that patients can also avail. So that's it for medical oncology.
Thank you, Dr. Luis. And next panelist who will answer our questions is Dr. CJ. So we've talked about surgery, di ba? Then we talk about chemo. So ang next question, may use ba yung radiation treatment in lung cancer? And what is radiation treatment, Dr. CJ?
Thank you, Doc June. So, good morning to everyone. So, ang radiation therapy po, isa po siya sa mga posibleng treatment for lung cancer kasama ng surgery and ng systemic treatment. Dito po, gumagamit tayo ng high-energy X-rays na itinututok po natin dun sa bukol or dun sa area kung saan may posibleng bukol para po patayin yung cancer cells o kaya pabagalin yung pag-spread or grow po nila. Sa proseso po ng radiation therapy, usually araw-araw po pumupunta yung pasyente, Mondays to Fridays. Pupunta po sila dun sa department, hihiga dun sa machine, and then yung meron pong parte ng machine na iikot naman po dun sa patient at itututok nga po yung radiation dun sa bukol. Ang radiation therapy po, pwede po siyang ibigay sa iba't ibang stage ng lung cancer, pero mag-iiba po yung objective, yung technique, and yung number of days depende sa stage. Tinitignan din po namin yung condition ng patient. Ibig ko pong sabihin kung malakas pa po ba yung patient or medyo weak na po. So that will also influence yung type of radiation and the other factors for radiation therapy.
Thank you, Dr. CJ. Dr. Luis, I think may question tayo for Dr. Joyce.
So, Doc Joyce, smoking cessation is not easy to do due to the frequent cravings and withdrawal. So what can our patients do at home? And if they relapse at home, do they have to be rushed to the hospital if talagang grabe yung withdrawal or craving nila sa bahay?
Thank you, Dr. Laris, Dr. June. Good morning, everyone. So, yes, smoking cessation is difficult. Actually, any cessation of any substance, no? Primarily, just to explain a bit, it's because there's already conditioning happening in the brain. So when we talk about craving, we look at it in two ways. There's probably physiological. So a while ago, parang na-mention that there can be a nicotine replacement, but there's also the psychological one, no, which we always see. So typically, it's related to your environment. Like I have a patient, pagka lunchtime, no, after lunch, magka-crave na lang siya agad. So it's really unlearning these things. So one of the things that you can do when you go to a smoking cessation program, for example, or when you see an addiction psychiatrist, most of the time we would actually do some therapeutic techniques. It can be cognitive behavioral therapy or mindfulness-based relapse prevention, wherein we try to reframe yung experience mo of craving. So for example, sometimes they can look at it as parang nauuhaw lang ako ng water. So parang you're trying to make new connections sa brain. For the home, usually what sets them to Relapse is if everyone else in the home does behaviors that promote smoking. So for example, let's say you're a family of 5, all 4 will smoke. So wag natin gawin po yun. If one person will stop, ideally, everyone else will do it as well. You have to throw away all of your cigarettes, throw away everything that will remind you of smoking. You also need to reduce your consumption of other substances because sometimes that would also increase it. So typically, it's more of really a lifestyle change for the person and the whole family for them to be able to be successful in not relapsing.
Thank you, Dr. Joyce. I think our next question is for Robbie Posadas. As the business manager here at Augusto P. Sarmiento Cancer Institute Lung Care Clinic, what are the available facilities and technologies that the medical city can offer for lung cancer screening and treatment? Robbie?
For those who have questions regarding lung cancer screening, we have the coordinating center at the 8th floor. So you may visit us there. We have very efficient nurses there who could answer your questions. They also do coordination when it comes to the different cancer screenings. We also have Nurse Navigator. The Nurse Navigator guides our patients as the patient goes through the treatment plan. The Nurse Navigator ensures that the patient will comply with the treatment plan on a timely basis. Sometimes kasi yung mga pasyente, they get confused kung saan pupunta, kung saan mag-uumpisa. So it's the role of the Nurse Navigator to guide the patient. For the screening, we have the low-dose CT scan at the Radiology Center. We have the PET scan naman for those who need to be, for those cancer patients na kailangan they need to be tested kung they have cancer or not, or kung nag-effect ba sa kanila yung chemotherapy. So those are the facilities that our cancer patient can visit. So it was mentioned by Dr. Ruiz that you can call us at 8988-1000 local 6214 or just visit us at the Cancer Center 8th floor.
Thank you, Robbie. Actually, I was about to plug that number again, 898-1000 local 6214. According to Direct, meron daw question from Facebook na we have to ask siguro. Siguro any of the pulmonologists does wearing face mask filter cigarette smoke? Sinong gustong sumagot? Dr. Tin, Dr. Chopay?
Definitely, wearing face mask can filter the cigarette smoke that a person might inhale. But for the person who smokes, even wearing a mask will allow that person to inhale back the smoke that he exhaled. So maganda talaga, quit smoking, don't smoke. If you have a family member who smokes, sabihin sa kanya sa labas siya manigarilyo. Huwag maninigarilyo sa loob ng bahay, lalong-lalong huwag maninigarilyo sa kwarto. Because the persons exposed to his smoke will be second-hand smokers, third-hand smokers, and like we mentioned, ito yung mga women partners. We are noticing now Asian female non-smokers having lung cancer as well. So ang risk factor na binabanggit doon, maaaring second-hand smoker sila. So do sa third-hand smoker, we don't want our children to be inhaling the smoke of smokers. They will have recurrent pulmonary infections, they will be coughing a lot. Magkakasakit din yung mga bata na yan pag lumaki sila. So, kung tayo ang hindi naninigarilyo at nagpe-face mask tayo, nakakatulong na makaiwas tayo. Pero for a smoker, lalo nilang nai-inhale yung exhaled smoke nila kung naka-face mask. So better smoke in open places where they will not affect non-smokers around them.
Thank you, Dr. Jopay. Meron ding tanong ulit sa Facebook. I think the answer should be easy for Dr. Jopay. Is there any vaccine or prophylaxis against lung cancer?
Wala pa pong available na vaccine for lung cancer at wala pa po tayong alam na prophylactic for lung cancer except that you prevent having it by not smoking, not including yourself in the group that are at risk for lung cancer.
Thank you, Dr. Jopay.
Healthy lungs siguro, emphasize natin, keep your lungs healthy and okay.
Ox ka lang, di ba? Dr. Laurice, I think you have a question for Mr. Michael.
So let's now further discuss the smoking cessation services available to TMC employees, our patient partners. Sir Michael?
With regards to employees, the Employee Health and Wellness Center is gearing up, stressing the importance of prevention treatments. So for employees, for smoking cessation, the pulmonary department, I think we have services under pulmonary services. The Employee Health and Wellness Center is very open with regards to approving those kinds of treatments as long as it is based on the management of the physician for the employees.
May bayad ho ba yan?
It will be under the benefits of the employees.
Okay, just asking. So I think for now, we do have a special guest here in the auditorium. He's a patient who will share his journey about having lung cancer and having survived. And he is a patient of Dr. Jopay Ramos. And may we introduce Mr. Rodolfo Cristobal, sir. Thank you for joining us. Maybe you could come here sa microphone. Sir, yung micro dito tayo.
Magandang umaga po sa inyo lahat. Dr. Josephine, Nampo Ramos, Dr. Christine Chavez, lahat po kayo ng doktor, Dr. Guilleri, at aking anesthesiology na si Dr. Zorino. Lahat po ako ay nagpapasalamat po at buong pamilya ko sa lahat ng doktor. Ito po ako ngayon. Nakasurvive po ako sa cancer stage 4. At hanggang sa ngayon po ako ay lumalaban at tuloy-tuloy pa rin ang aking immunotherapy. Ang masasabi ko lang po, itigil na lang po natin yung paninigarilyo. Wala po tayong makukuhang mabuti dyan. Puro sakit lang po. Almost 25 years po ako nag-smoke. At nalaman po ni doktora na sabi sa akin, magpa-x-ray ka. Meron kang TB. Lumabas ang result, may TB ka. Binigyan ako ng gamot ni Doktora Ramos. Sabi sa akin, Doktora Ramos, huwag kang mag-alala. For 6 months, sagot ko yung gamot mo. Galing sa DOH. Na makalipas na 6 months, binigyan niya ako ng sabi niya, magpa-x-ray ka, apiculondotic. Kasi ibang nangyayari sa iyo. Sabi niya sa akin, ginawa ko yun. Ngayon, lumabas sa apiculondotic, ang result, merong mass. Ngayon, nirepair naman nila ako ni Dr. Ramos kay Dr. Christine Chavez. Ang sabi naman sa akin, Dr. Christine Chavez, na kailangan mo ng biopsy. Pagkatapos ng biopsy, na lumabas sa result na meron akong cancer stage 2. Agad-agad kailangan maoperahan ka as soon as possible. Pinagplanuhan po namin ng pamilya na ako'y maoperahan. Last September 9, naoperahan po ako. Hanggang sa ngayon, buhay po ako. I survived sa cancer. Nagpapasalamat po ako sa lahat ng doktor.
Pinapatanong, kailan kayo nag-surgery? Anong year?
Nag-surgery po ako ng September 9, 2019. Ito po. Ito po yung sakit.
So 3 years na kayo after surgery, no?
3 years and a half. magaling po yung doktor ko, si Dr. Giliege, Dr. Sorino, Dr. Ramos, Dr. Christine Chavez. Magaling po sila.
Thank you very much, Hopag, for sharing your journey with us. Mabuhay kayo, and you serve as inspiration for our patients who are currently battling lung cancer, and for our patients na you should avoid smoking kasi walang vaccine for lung cancer. Okay? Okay, and thank you sa doctors din, Dr. Jopay and Dr. Tin for helping you through the journey.
Thank you, Doc.
Okay, maraming salamat po. Palakpakan ho natin siya. I think we don't have any more time, and I think there's no more questions. So thank you so much to our speakers and panelists for providing us your time and wisdom this morning. Dr. Alan, Dr. Tin, Dr. Jopay, Dr. Francis, Dr. CJ, Dr. Joyce, Mr. Michael, and Robbie, and Laurice. We want to thank them too.
So what an insightful event, and I hope all of us here are now equipped with knowledge on lung cancer. It is indeed an overwhelming battle, but the Medical City, together with APSI Lung Care Clinic, is here with you every step of the way.
Prevention and early detection of lung cancer is the key. To our smoking friends, we hope that this serves as a reminder to you to take charge of your lung health. We at the Medical City are here to help. A simple message asking, "Ox ka lang," can go a long way. This has been Dr. June Ruiz
and Dr. Laurice Arayan.
Thank you and good morning. Okay na yata. Okay na.
Lung cancer is the most common cancer worldwide, and it is the second most common form of cancer in the Philippines. It is a form of cancer that starts in the lungs and can spread to other parts of the body. 90% of lung cancers are caused by smoking or tobacco use, and the risk of cancer increases with the number of cigarettes smoked over time. Early-stage lung cancer usually has no symptoms because cancer cells spread slowly, especially in more common non-small cell type cancers. When signs of the disease do start to appear, they may include the following. To determine if patients have lung cancer, doctors often ask them to take one or more of these exams. If a patient is diagnosed with lung cancer, there are many treatment options available, like surgery, radiofrequency ablation, microwave ablation, radiation therapy, chemotherapy, targeted therapies, and immunotherapy. Sometimes doctors will use 2 or more treatment options to deal with lung cancer. With every passing day, scientists and researchers discover better treatments for lung cancer, as well as more effective combinations of existing treatments. At the Medical City, we have a dedicated lung care clinic. Its mission is to take the experience and expertise of our multidisciplinary team of physicians, the latest breakthroughs and technologies in cancer diagnosis and treatment, and combine these with the Medical City's unique patient-centered philosophy in order to provide lung cancer treatments that are holistic, personalized, and compassionate. At the Medical City's Lung Care Clinic, patients going through their treatment process are guided by our lung care nurse navigator. The Lung Care Clinic offers screening and diagnostic services. Lung cancer screening is recommended to detect early cancer among patients who are at risk for developing lung cancer. The Medical City recommends a low-dose volumetric chest CT scan as a screening tool for lung cancer. In addition, the Lung Care Clinic also helps patients quit smoking through the Start a New program. For patients and their families who are facing the reality of lung cancer, the journey is hard. But it doesn't have to be a lonely or hopeless one. And because lung cancer diagnosis often prompts a second opinion, our medical team reviews and discusses diagnosis and treatment with the patient and their attending physician. Our medical team takes into consideration the uniqueness of both the patient and their disease, even up to the molecular level. By embracing this uniqueness, we are able to offer treatments that are tailor-fit for each patient. Taking a holistic view of the patient's health, we offer supportive care. This includes rehabilitation services along with nutrition, as well as psychological and family counseling. The Medical City's Lung Care Clinic gives patients the tools to deal with lung cancer through cutting-edge medicine and compassionate care. We offer a fighting chance. We offer a helping hand. We offer hope.